Welcome to our Fascial Fix for chronic pelvic pain. Chronic pelvic pain syndrome, CPPS, is the name given to a group of pelvic conditions that affect both men and women. Common symptoms can include genital and rectal pain, frequent urination, lower back pain, and painful bowel movements. The causes for CPPS are not always clear, but it usually involves an overtight or spasmed pelvic floor, and for many people this is associated with an increase in their stress levels. In this video we share some simple self-help myofascial exercises that can help to relax the pelvic floor and pelvic area and help to reduce symptoms and stress levels. In this exercise I'm going to do a fascial squat, which is also known as a flat-footed squat. I'm going to start just by getting into the squat position, coming down with my feet flat on the floor and dropping my bottom back so that everything is relaxed in my pelvic area. So just squatting in this position, allowing your body weight to drop back into your bottom. What this does is it starts to relax your pelvic floor. Your pelvic floor are the internal muscles that help with posture, with fluid flow out of your body. Sometimes these can become very tight and restricted, and this can start to cause pain and other problems that you may feel in your genital area, your groin, or elsewhere in your body. So to do this for a minute or so initially helps to start to relax your pelvic floor because everything is just dropping down and letting go. If you find it's uncomfortable to do this, or in fact you get a sense that you're just going to fall over backwards, then you can hold on to something. So just as a demonstration here, I'm holding on to this door, or you can hold on to a door frame or any piece of furniture that is not going to move as you allow your body to relax into the squat. So by holding on to something, it means you're not going to fall over backwards, and you can let your body relax more and your weight drop back more into your bottom. This is an exercise to practice, and maybe start initially just with a minute and then gradually build up the amount of time you do this for. Some people find it really easy to do this exercise, particularly if they have any degree of hypermobility in their joints. However, for many other people, it can be quite difficult because we spend so much time sitting in seats that we're just not used to squatting and allowing our body to balance itself. But by doing this regularly, it can really help to open out your pelvis, to relax your pelvic floor. This can help with digestive issues as well, because again, a lot of the time when we sit in seats, we're squashing our digestive system. So a nice exercise to do to gradually allow your pelvic floor to relax and your pelvis to start to open out. In this exercise, I'm going to use a myofascial ball to work on the inside of my thighs. To do this, I'm going to lie on my front on the floor, and then I'm going to bring one leg up into a right angle position and place the ball underneath my inner thigh, and then relax onto the floor. So you can place the ball anywhere from your groin down to just above your knee, and just allow time for the tissues to start to release around the ball. So remembering that this can take a couple of minutes for the fascia to start to release, and you're just waiting for a sense of things softening and changing, and you may feel different sensations here as the tissues release. The inner thighs can become restricted, mainly due to injury. So this can be a sports injury, or it could be due to slipping. So for example, slipping on ice where your leg stretches out from underneath you. And this can create a strain in the muscles in this area. And because of where they are, sometimes when you have restrictions in your inner thigh, this can be felt up into your groin and even internally into your genitals. So this is a great way of starting to release some of the tension in the tissues and allowing your tissues to let go. So once you've been here for a couple of minutes, then you can work on the other side as well. Again, lying either on the floor or on your bed, bring your leg up into a right angle position and place the ball underneath your inner thigh. And then just relax your body around the ball. A lot of the time when you have an injury in this area, it creates scar tissue, and the scar tissue restricts the movement of this leg. So each time you extend your leg or you try to drop your leg outwards, it can pull, and this can create a lot of the pain that you may feel in the inner thigh or into your groin area. So when you're here, just allowing time for the tissues to start to release and let go. And as long as you're here for at least a couple of minutes, then the fascia will be starting to release. And when you work here, you can always move the ball to different positions, anywhere from the top, so just beside your groin, to down towards just above your knee. The inner thigh muscles extend for all of this area, and so you'll find different points that feel more tender, and as they release, they allow the tissues to relax and they allow the symptoms that you may have been experiencing to reduce. In this exercise, I'm going to do a spine twist. To do this, I'm going to lie on my back with my knees bent. So when I'm here, I'm now going to drop my knees over to the right and allow things to start to relax. Now, if you're like me and you find that your knees don't touch when you're in this position, you can put a pillow in between them, and that just helps to support your legs and your hips and means that you can allow things to release and relax. The spine twist is a really nice exercise to do to open out your hips and all the way through into your back. It's important to keep both shoulders on the ground when you do this, so the actual twist is coming in your lower back and in your hip. And by doing this, this can start to release some of the restrictions that may have formed, particularly around the side of your hip. And these can be contributing to lower back pain and hip pain, even leg pain. So as you're here, you're just allowing things to start to release and relax. And you may feel sensations that may be in the area around the side of your hip, or even coming up into your back or down into your leg. So whatever you're feeling, that's fine, that's okay for you. And if you want to create a slightly deeper stretch, you can straighten your top leg out. And this will stretch more into the side of your hip in particular. So this is a great exercise to do if you have lower back pain, if you have knee or hip pain, And it can really help to release round into your back as well. So I can feel this coming up into my mid back, and sometimes people feel it coming up into their shoulders. And so as long as you're here for at least a couple of minutes, then it's allowing time for the tissues to start to release and let go. And then we can do the exercise on the other side. Coming back to the midpoint and then dropping your knees to the other side. Again, my knees don't touch, so I'm going to bring the pillow over again and place that between my knees. Again, this is just allowing my body to start to relax and release, and starting to feel a stretch coming into this side of my hip. If you're comfortable doing this exercise on the floor, that's great, but you can also do this on your bed if that's more comfortable for you. And again, if you want to create a deeper stretch, then you can straighten your top leg out and just allow it to drop down. And so the weight of your leg is now creating a deeper stretch coming round the side of the hip. You may feel it more in your hip, in your back, in your leg. Wherever you're feeling it, that's fine. That's your release pattern. And you're just waiting for a sense of the tissues starting to release and let go. So really good for helping to loosen your lower back and mobilize the tissues here, and for starting to release around the sides of your hips as well. So just being here for at least a couple of minutes allows time for the tissues to start to release and let go.